Good morning, everyone. Today I'll be talking about the intermuscular spaces, which are the quadrangular spaces, the upper triangular space, and the lower triangular space. It's a very common question which is asked in your dissection when you'll be having your examination on supex. It is a very common question. And it's very easy to remember. Okay, so the trick is, if you take two fingers laterally, these are placed laterally, okay, and these are placed medially, right? Your middle finger represents the humerus, and your um, index finger represents the long head of triceps, while your medially, your middle finger represents the teres minor muscle, and the index finger represents the teres major muscle. Now if you just crisscross these two fingers like this, see this. This is the trick. If you crisscross these two fingers of each hand, then you will see in your upper portion there is a quadrangular shaped space. In your medial side, you will be seeing a smaller upper triangular space, and on the lateral side, you will be seeing a smaller lower triangular space. Okay, so this is your trick. So the upper part, the quadrangular space, you see it's bounded by this finger superiorly, that is the teres minor muscle. Posteriorly, anteriorly is subscapularis muscle present, and inferiorly this finger represents the teres major muscle. So the quadrangular space is bounded by superiorly by the teres minor muscle and inferiorly by the teres major muscle. Now coming to the lateral side, your this finger represents the shaft of humerus, or the head of humerus, you can say, for the quadrangular space, while this finger represents the long head of biceps brachii. So laterally, the quadrangular space is bounded by the shaft of humerus, and medially by the triceps brachii. The content of quadrangular space is your axillary nerve and posterior circumflex humeral vessels, that is artery and vein. Now coming to the upper triangular space, which is this portion. The upper triangular space is bounded superiorly by the teres minor muscle and inferiorly by the teres major muscle, right? And laterally by the long head of triceps. Its content is circumflex scapular artery. Coming to the lower triangular space, which is this space, the lower triangular space is bounded laterally by the shaft of humerus, medially by the long head of triceps, and superiorly by the teres major muscle, right? And the content of the lower triangular space is profunda brachii artery and vein, and the radial nerve, right? So this is about the intermuscular spaces, and this is the trick to remember it. Okay, remember this trick and it will be very easy for you. Thank you so much.